welcome to everyone who is joining us tonight for our Zoom chat about breast implants and breast implant illness. March is Breast Implant Illness Awareness Month, and we really appreciate you being here tonight. We're going to talk a bit about the signs and symptoms of BII, which we use interchangeably. That is breast implant illness. We'll talk about what the FDA and the breast implant manufacturers have to say. And then most importantly, we want to talk about what you, the patients, have to say. We'll open up the mics in just a few minutes and let you ask your questions. But first, I have just a few housekeeping reminders for tonight. So first, the event is being recorded. The video of the program will be published to the Executive Plastic Surgery website and their social media channels. There's also the possibility that it may be shared on media platforms that are not controlled by the Executive Plastic Surgery group. And we just want you to keep that in mind as you share your information. Share information and share any kind of medical information in your questions. So right now, everyone is muted. We'll continue to mute people as they come in. If you'd like to ask a question, please wait until we call on you to unmute. If you will repeatedly unmute yourself, it can be kind of disruptive, and we do reserve the right to remove you from the room if you do that. Additionally, profanity and explicit language will not be tolerated, and again, we will remove you from the room if you use it. There are two ways to ask questions. So if you'd like to verbally ask a question, you can use the raise your hand option. So depending on your Zoom setup, you might find that under the participant tab, or you might find it under the reactions tab. So we will call on the verbal questions in the order that they're received. If you'd like to send a written question, feel free to use the chat box to type out what you'd like to have answered. Again, we'll do our best to answer those questions in the order that they're received. So without further ado, I'd like to introduce you to Dr. Shaher Khan. Dr. Khan is a double board certified surgeon. So he is board certified by the American Board of Plastic Surgery and by the American College of Surgeons for General Surgery. Dr. Khan also has a bachelor's in biochemistry and did a burn fellowship in burn and surgical critical care. Dr. Khan is an MD, and his practice is devoted exclusively to the three following procedures. So first is breast implant removal, also known as explant or en bloc or total capsulectomy. The second is the removal of residual capsules. The third is the flat closure after removal. So let's get started. Dr. Khan, welcome. Why don't you share a little bit about what breast implant illness is?
Thank you very much. I welcome each and every one of my viewers. Please share this information. It is this awareness that we're trying to do, and hopefully we can just share what is objective, critical information that every patient must be aware of so that they can make an informed consent. Now, what is breast implant illness? Breast implant illness is a constellation of signs and symptoms that are a direct result of the silicone leaching, be it from saline implants or silicone implants, from day one at times, and affecting the body negatively, where you have the many symptoms that affect almost every single organ system, some more, some less, some others, over a period of time. So you have the many patients with, for example, the chest pain, shortness of breath. You have patients with psychological disturbances, fatigue being the most common, joint pain, rheumatological problems, GI disturbances, visual problems, headaches, the ENT, the ear, nose, throat, upper neck and back pain, amongst the many other signs and symptoms. There is a questionnaire that we have, 50 questions where you can check off the symptoms that basically are affected as a direct result of what one will assume to be what is breast implant illness. Now, it is important for the patient to go ahead and get checked by their primary care doctor so we can rule out other objective causes of what is breast implant illness. And if and when they're ruled out, we can point more towards these symptoms that collectively are termed breast implant illness, which is a direct result of the silicone toxicity.
It would help if I unmuted myself. Dr. Khan, there are a lot of signs and symptoms of BII. Can you list out some we see them on the screen. What are the top 5 that you might see in the patients that
So
you're?
the most common is fatigue, just tired. Patients would sleep 8-10 hours, then they could still sleep another 5-6 hours and still be very tired and lethargic. Rheumatological joint problems. They have problems with chest pain, shortness of breath, difficulty breathing, neck and back pain, and then GI disturbances. And a lot of patients with psychological problems such as anxiety, depression, along with panic attacks, feeling like they're dying, kind of malaise type of a feeling. So these would be the most common ones that the patients present with.
None of those sound very comfortable. I do want to remind folks, if you're on the line and you want to ask a question, you don't need to wait. So go ahead. You can either raise your hand if you want to ask it verbally, or drop those questions in the chat box. While we are waiting for questions to come in, one of the things that we want to talk about tonight was the FDA warnings that came out. The first one is about the breast implant associated large cell lymphoma. So can you tell us more about this one? And then there's another warning too.
Sure. So this is the FDA in 2021. And again, they basically mentioned this very clearly. They stated 3 things that were a direct result of what is the breast implants, both saline and silicone. So the first thing that they mentioned was, number 1, that the implants are not meant to be in the body forever. If you look at their readings and basically their publications, they mention anywhere from 10 to 15 years before you would need to replace. The second thing that they mentioned was exactly what you have up here on the slide, that they are a direct result of what is breast implant associated anaplastic large cell lymphoma. So it is a direct cancer that's directly associated with breast implants, specifically textured, but they also, if you look at the word and the verbiage, they mention others, which means smooth implants too. And so it is not exclusively the textured implants. And there is a direct association. Had the patient not had the implants, she would not have gotten the BIA ALCL. And then last year in September of 22, they very interestingly, the FDA clearly reported what is a direct correlation of squamous cell cancer with breast implants. And just in a recent meeting as early as this week, they reported that the number is much higher than what has been reported. And because the silicone causes these inflammatory reactions, the capsules are not being sent and evaluated by the pathologist. So the numbers are certainly very much underreported because not everyone is checking for them. And so they anticipate the numbers are going to be much higher, and they have asked the plastic surgeon communities all over the world to report any adverse effects such as the BILCL so they can keep a tab of the adverse events. And the third thing, as you mentioned, the FDA has clearly mentioned, and you can go to the other slide where they mentioned that patients present with, and if you look at receiving breast implants, have reported a variety of systemic symptoms. And this is the breast implant illness symptoms such as joint pain, muscle aches, fatigue, autoimmune diseases, and others. And they mention over here the risk for developing these symptoms have not been fully established. But then look at the very last line, quote, some patients report complete resolution. So the patients, when they remove their implants and certainly the capsules, they report complete resolution of their symptoms. And now, as you will see, there are reports, for example, out of the plastic surgery group in Utah. There's another plastic surgeon out of Louisiana who has basically removed the entire implant plus capsules, and they're reporting well over 90% relief rate for these many patients with the many symptoms of what is breast implant illness with, quote, complete resolution when the implants are removed without replacement. So again, this is the FDA's word. So these are not my words. This is not my opinion. This is hard, established, objective evidence directly produced by the FDA, clearly stating that this is bad and you need to be aware that these problems exist.
Yes, and that's really scary warnings and out there from the FDA itself. We have several questions waiting for you. We're going to call on Robert and Margaret first. If you want to unmute yourself, you can go ahead and ask your question.
Yes, thank you for hosting this first off. But a question that we have, so prior to my wife having implants, she did deal with some anxiety and depression, but it's gotten worse. Can that enhance some of the symptoms over
Yes,
time?
absolutely. Now, this is a very good point. There are many patients who have had underlying problems such as anxiety, other psychological problems. Now, let's look at a hard fact. There are many ladies who have had no history of anxiety or depression or psychological issues. And when they got implants, this is very clearly established. If you just listen to the many ladies, their testimonials, you will clearly see a direct link of breast implant illness and their many symptoms of anxiety, depression, suicidal ideations, among others. So one can assume that the implants are making it worse. Now, I cannot prove, neither can a psychiatrist. But one thing is for certain, when the implant is removed, along with the implant and the capsule and all inflamed tissue, post-operatively, then we can look back and assess and see in what capacity she has improved. Absolutely, there is an additive effect, if at all. I cannot tell. No one will be able to gauge. There is no like objective meter, if you will. There are some days, remember, the depression is good. Some days the depression is bad. Sometimes a depression in a patient with no implants can get progressively worse, right? Our lady, for example, postpartum depression, it can set in all of a sudden. A lady with no implants, she can have much or worsening sign symptoms, even though she may have depression before she got pregnant. And the point here is once the implants are removed, we will see in what capacity were the implants contributing to. There is no direct test for me as a plastic surgeon, or I'm sure even as a psychiatrist, as to gauge the intensity of the depression that got worse as a direct result of the implants.
So we have a couple of related questions to this about symptoms after having explants. I'm going to read these two together. They're from Lori and Lucy. The first one is, what are lingering issues or symptoms following the explant of a silent, severe ruptured silicone smooth implant? She's still at risk of BIA, ALCL, or other cancers. And then the next question was, how long after removal?
Can I please ask you if you could please repeat that question again?
I can. That was a really long one. It is, what are the lingering issues or symptoms following the explant of a silent ruptured silicone smooth implant? Is she still at risk of BIA, CL, or other cancers after explant?
Very good question. So we know of case reports where the patients had implants removed, in this case ruptured. So there was very likely free floating silicone within the chest. And very likely the capsule was not removed completely or definitively. So there are case reports that are present that state 4 years later. So for example, if you go to my private breast implant illness support group page, the Facebook page, which is a private page, you will see, and if you type in BIALCL, there is a case report where a patient removed her implants and she had residual capsules. 4 years later, she had what was development of BIA-ALCL, which is the breast implant associated anaplastic large cell lymphoma. And so we clearly see from that case report, now that is one case report, that there is a direct association of residual capsules causing the continued inflammation and the detrimental effects that ultimately led to what is the BIALCL. So number one, you got two problems. You have a problem of not only the residual capsule, i.e. the capsule that was left behind, but also more importantly, and equally importantly, you got the silicone that likely ruptured within the chest, because I'm sure the surgeon did not do it en bloc. And that silicone that was free floating, that would not have been removed by the drains if she did have any, that will continue to linger on. So in this situation, I would recommend getting an MRI with and without contrast, so as to detect any silicone granulomas, silicone deposits, or pockets that might be present, usually sedimented down because of the gravitational weight of the silicone. That needs to be removed along with the residual capsule, so that this patient has the best bounce back, hopefully to a normal state of good health, minus the capsules plus the already leaked silicone.
That is really great information. I think we're going to come back to that because we have a couple of related questions, but Crystal has been waiting to ask her question. So Crystal, if you want to unmute yourself and ask your question.
Hi. Okay, so in December of 2020, I got my implants removed, but he did not remove the capsule. He actually didn't even try. He said that he cauterized the rest of them, so it shouldn't cause me any problems, which I know is bogus, but I've just continued to get worse and worse since then. And so I guess my question is, I'm nervous. Well, I don't know if he lied about it, first of all, if he cauterized them actually, but I guess my question is, I'm scared to go to another doctor to like pay all this money and get the rest removed or try to, and there not be anything there because he cauterized it. Have you ever seen that? Have you ever seen someone come in that you had to remove the rest of the capsules and they had them cauterized, and is that an issue?
So very good question. I want you to, if you can, look at the post that I posted today on my personal page and also on my Facebook private breast implant illness support group page just today, approximately 6 hours ago. So here's a lady, believe it or not, this is her own words. She went to her plastic surgeon, a reputable board certified plastic surgeon, and she had an understanding with her surgeon to removing the whole implant and the capsule. She underwent the surgery. I saw the operative report myself, which said the patient had what is, quote, a total capsulectomy. And you will hear her own words. So she explanted in 21, if I believe, and she was not continuing to get better. Now, remember, we have an operative report that says that she had complete capsule removal plus the implant, and she should be getting better. Now, she continued to have the many signs and symptoms of breast implant illness, and she knew from her heart, listen to this nice lady's own words. So she came to me, she said, I'm not going to live like this, so I have a choice because I can tell. Now, I looked at the operative report myself and I critically, line by line, word for word, analyzed it, and I concluded there has to be capsule remaining behind because the word en bloc was used incorrectly and the word total capsulectomy was used. And then the surgeon herself stated that she went to the fourth rib and removed some of the capsule. How can you do an en bloc or a total capsulectomy and then go back and remove the fourth rib capsule? So she came to me exactly 3 weeks ago, and you will see again the pathology report that shows chronic inflammation within the capsule. And most importantly, you will hear her own words because on the 12th of April, 2023, she and I will be doing a Facebook Live to talk about her story because that's the worst and the last case scenario that you want to be in as a patient, where you now have to undergo a second surgery in order to remove the residual capsule plus the inflamed tissue that is in the periphery around what is the silicone leaching implant. Now, in your case, when someone cauterizes the capsule, which is very easy to do, you're leaving behind the badness. You're leaving behind the tissue that has in it the silica. Just like if you can imagine 4th of July weekend, you're doing the barbecue and the food gets burnt on the charcoal grill or any grill. And the next thing you know, there's still remnants of what is food directly on top, right? Because that's the cauterized capsule, right? And then once the implant is removed and that quote partially removed capsule remains behind, that in itself is enough to continue to hurt, cause the triggering of the breast implant illness. Maybe not as severe as it was before, but still enough to the point where the patient feels the hurt and the many signs and symptoms of breast implant illness, but not as bad as what it was before. And you will know as a patient that it still continues to hurt because you have two options: do nothing, pray to God, or let the passage of time, at least a year or two, go by so that let things normalize, or to go under the knife again and to go ahead and get the residual capsule plus any inflamed tissue out. Remember, it is as important to remove that residual capsule plus remove that inflamed tissue that's in the periphery of that capsule, because that in it also harbors the silica that might have extravasated or leached out in the periphery because it is inflamed tissue. So hopefully that answers your question. So it is incomplete. It is not a complete surgery that you got. Cauterizing is not good enough of an answer. It has to be physically removed, and the fascia. So this is very important. the fascia of the intercostal muscle, the fascia of the rib, which is the periosteum and the perichondrium, if there is rib with cartilage, the fascia of the pectoralis minor, and the fascia of the serratus anterior needs to be removed definitively along with the capsule, because that essentially ensures that the entire implant capsule plus all inflamed tissue is removed. And I want you to go to any of my YouTube videos where I actually show the chest. It's a graphic, or some of my Facebook posts, and you will see the ribs directly raw. Like you're going to be looking directly at them. Imagine if you're at a restaurant, and sorry to gross you out, you have a layer of tissue directly on top of the rib that needs to go, and that is explantation, and that is the heart of what is explant surgery. That is the gist. You should not be asking your surgeon to remove the capsule. Your surgeon should be telling you that he will remove the capsule, because that's the whole essence of explant surgery. You should not be twisting her or his arms. You should not be asking the surgeon and talking to a physician assistant or a nurse practitioner or a medical assistant and having a discussion. You need to have that direct talk with your surgeon, and your surgeon should be telling you that I know convincingly, definitively, that your post-operative course is dependent on me, the surgeon, removing the entire implant capsule plus all inflamed tissue, because if I don't, you will continue to hurt and suffer, just like this lady today that I posted today. And I want you to please go see and listen to her own words, and please join us on the 12th of April, so you can see and hear from her definitively and how she's doing post-operatively. Very dramatic recovery. And most importantly, you also look at the pathology report that highlights and tells you that that was the chronic inflammation. So hopefully that answers your question.
So you're saying that I shouldn't worry about, I think I'm just worried that if I go back under and it's cauterized, they're not going to be able to remove things, but that's not true. Is that what you're saying?
So that is, so remember, it is not an easy surgery. So I will tell you, if you go to 100 plastic surgeons, 90 of them will flat out tell you, who's telling you to remove the capsule? It's not even recognized. It's too dangerous. Of the 10, they will say, well, we'll try. Some might say it's too thin. But remember, you have to go to someone who from his or her heart willfully, deliberately, religiously, and is motivated to removing the whole residual capsule. Now, I will tell you how much of the capsule was removed. Look, in this case today that I just posted, right? She has an operative report that says 100%. She also had an MRI that states that there is no capsule remaining behind. And I've done a couple of other Facebook Lives with other ladies who had basically explanted and residual capsule was left behind. So to answer your question, my recommendation is for you to get an MRI with and without contrast, just to be absolutely certain there's nothing that is there that may potentially be picked up on an MRI. And number two, because your capsules were cauterized, depending on the length of the surgery. So if your surgery was done in an hour and a half, right? With absolute certainty, the entire capsule was not removed. Therefore,
it was literally an hour and a half.
Yeah, and I can tell this because just today there was another surgeon who did the surgery in an hour and a half, and I can tell you, just to get the patient in and to start prepping and making incision is 20-25 minutes. To close is 25 minutes. You cannot but spend 15 minutes just removing the implant and saying, oh, she's going to be okay, don't worry about the capsule. And this is unfortunately the norm at any given plastic surgeon. If you get on a plane and you go to the top 100 plastic surgeons in the country or the top 100 hospitals or medical centers, inevitably this is the same answer you're going to get. And this is what we're trying to change. So going back to you, it takes me 4 hours to removing the entire implant capsule plus all inflamed tissue, because that is what it takes for me. And remember, this is all what I do. 99% of my practice is exclusively devoted to removing the whole capsule. And this is where the many other ladies who have had partial capsulectomies, which is in your case, the residual capsulectomies, once that is done and complete 100% removal of not only the entire implant, but the capsule, plus all inflamed tissue, that has to go too. And this is where I've coined the 100-100-0 rule. That's item number 7 on this, the Khan procedure. where 100% of the time, 100% of the capsule is removed along with all inflamed tissue, with 0% of the capsule remaining behind. And again, why do I say this? Look at the many pathology reports. And number two, look at the many patients who have had to go back for residual capsulectomy, and only then did they go back and recover fully from the many symptoms of breast implant illness that lingered on despite removal of the partial capsule and the implant.
Moving on to our next question, it's somewhat related. You talked about what you would remove internally, but the question from Heather is, when you complete the en-bloc total capsulectomy, do you remove any excess skin? So that's external.
Yes, so this is what I have started to do pretty much now on most patients. Now, there are some patients, for example, the 27-year-old where her skin retracts and she has, like, say, 220 cc implants, where the skin itself, remember, 30 to 40% of the skin is going to recoil because of the full thickness nature, the young, healthy, elastic skin. So in those patients, I do not remove skin. In majority of the patients where you have bottoming out, which means the implant starts moving down plus outward, where you have what is the implant works essentially as a tissue expander, if you will, and it lateralizes because it falls through the muscle. In those patients, I remove that excess skin, and what that does is it does what is a pseudo lift. It rotates the skin inward and upward and allows for the nipple areola position to be, quote, positioned a little bit higher. That would be certainly much more aesthetically pleasing.
Absolutely.
And I will tell you from my experience, again, but 80% of my patients do not need a lift. They have not needed a lift as a result of the way I explant by making a horizontal incision, where majority of the implants, when they're below the muscle, I'm always dissecting below the muscle directly on top of the rib, such that the breast tissue is not touched and it gets the chance to recoil.
So that actually leads us right into our next question. And we have several questions lined up. So this one's from Heidi. What if the surgeon said it was too close to the ribs and risk of lung puncture, and that's why they did not get to all of the capsule? Is that a possibility?
Yeah, so that is absolutely a possibility. Remember, this is involved surgery. Now let's look at the hard facts. Number one, this is outpatient surgery. No one gets admitted post-op. It's very well tolerated. Your surgeon has to be skilled, determined, has to have a track record, and should feel absolutely comfortable operating around and on top of the rib, such that this can be done safely and definitively. It is not easy. I will tell you, another surgeon and one of my assistants and many other surgeons that I've talked to, they say it's too invasive. It's too big of an incision. Yes, absolutely it is. To put in an implant, I saw our operative report for augmentation, 30 minutes, 45 minutes. On average, it's done, and vast majority of the surgeons do it under 1 hour. It takes me 4 hours. This is how long I book my patients. And I'll tell you, a good 2/3 of the time I'm running past the 4 hours, so whatever length of time. One day I was at the hospital and I was doing the case. And for example, I did a case this past Monday. It was a complex patient, and another case on a Monday prior. These were very complex patients. They would come knock on the door and say, when are you going to get that, Dr. Khan? And I tell them, I'll get done by midnight. I never give a point. And, for example, whenever they give me a time, they block 6 hours because they know I have no feelings for the next patient waiting, because I'm not going to compromise my surgery. I have had patients that waited, unfortunately, 3 hours in the waiting area because that one implant took me 3 hours to do. And this is what it takes. Remember, sometimes I go in and before I even know it, I was out, because it was relatively easy, and only when I do go in. So to answer the question, it varies and it is very involved, and it is not an easy task, and not every surgeon can do it. Now, I will tell you, a big part of my training was general surgery, where, for example, gunshot wounds to the chest, breast cancer reconstruction with post-radiation, and you have ribs that need to be resected, right? The thoracic surgery reconstruction. Putting in chest tubes is easier for me than to send a fax, without any exaggeration. Chest tubes are done by EMTs on the side of the, they do needle decompression, if you will, for pneumothorax. And the emergency room, chest tubes are put in. This is a procedure where they're removed a day or two later. Now, that is true. no one, the explant surgery is not an easy surgery. And I will tell you, as a board certified general surgeon and a board certified plastic surgeon, I sincerely believe every surgeon cannot do it. Just to look underneath and dissect in a area that might be 12 inches deep, right, with the neck bent for hour or two at a time, certainly compromises the neck. And I'll tell you, there are some surgeons that have literally told me I could never do that surgery from a physical perspective, meaning as far as being able to stand there and operate, because surgery itself is physically demanding, mentally demanding, and certainly you have to have that strong-willed heart that you're going to do it. And this is, remember, you're not going to go into the surgery and say, you know what, I left the cancer behind, because you never know what it is going to be. And going back to the point here is, it is hard, it is involved, and your surgeon must be absolutely determined to state that that capsule will go, and it needs to be done, and it needs to be done with full confidence. And the 100-100-0 rule therefore applies very much so.
Yes. We have some questions that are waiting here about symptoms. So the next one here is from Pat. She says, I'm not totally sure my symptoms are BII related. My implants are 16 years old. Do you recommend removal due to the age of the implants just themselves?
Does she now, number one, let's look at the FDA fact. Number one, are implants meant to be in the body forever? No. 10 to 15 years. From my experience, you will see it is 7 to 10 years before they start becoming reactive. Some ladies sooner, some ladies 20 years later. I had a lady that came to me from Arizona. 30 years later, she's like, my left side hurts. And guess what? She had a rupture that ultimately occurred. Now, this is where you don't want to wait for a rupture. Remember clearly, just look, they're not meant to be in the body forever. And when you start reacting, you really have to, I say to you, would you rather take care of a small fire or a big fire? And I will tell you, it is easier, simpler, better to take care of a non-ruptured implant than to take care of an implant that has ruptured. Now, let me show you this. If you look at, this is a very heavy question too. If it ain't broke, don't fix it. But guess what? It's only going to break. Now, this is well published. I want you to go ahead and research, and you can do that. It doesn't take much. This is a study, and if I'll show you right here, I guess you cannot see, and I'm going to read. For modern implants, now this is, I can put this on my page as well. For modern implants, generation 3 or later, this Danish study estimated that rupture-free survival of 98% at 5 years and 83% to 85% at 10 years. They concluded, and I'm quoting, they concluded that modern implants are durable for 6 to 8 years, period. Rupture risk increases significantly after 6 years, with 15% of modern implants expected to rupture between the 3rd and 10th year after implantation. And what did they do? They basically looked at implant ruptures evaluated in patients with intact silicone implants by MRIs at every 3-year intervals. So this is hard evidence right here. Now, the MRI without contrast is the ultimate way to look for a silicone rupture. Saline implants, when they do rupture, they're like a water balloon, they collapse completely. Silicone implants, the MRI is the best test, not a mammogram, not an ultrasound. And the MRI, you will see what is the Linguini sign. Again, you can Google this information, you can see it. You can go to my Facebook page again, there's a lot of information there. And you will see, no one is going to willfully say, okay, remove my implant because I think it's ruptured. Remember, there is this term called silent rupture. I have had patients that I've taken care of, many of them that presented, exam is unremarkable. I have no pain. And lo and behold, I do the explant, I cut open the capsules. To my surprise, to the patient's surprise, she has both of them ruptured, and an exam that was totally benign. And this is what they call a silent rupture. So better and smarter and wiser to take care of a problem before it becomes a bigger problem, before it ruptures,
yes,
before it disintegrates. And that is very important.
absolutely. In getting that early awareness is very important. I think you answered this. Heather's question was, how do you know if you have a rupture or a leak? You mentioned the MRIs. Is there anything else she could do?
So a good physical exam by a board certified plastic surgeon, number one, an MRI, number two. Now, if you have pain, capsular contracture, hardening of the chest, amongst the many signs symptoms, then my recommendation would be either do nothing, which you don't want to do because you're hurting, right? It's negatively affecting you. The second option is to remove the implant and to remove it with the entire capsule and with the thought that if there is anything abnormal, that must be removed and sent to pathology, because you could potentially be having badness. Badness could mean inflammatory cells, local rupture, focal rupture, extravasation of the silicone. This is the capsular contracture, where you have hardening of that capsule around the implant, where you have the four, what they call the Baker's classification, where if someone states they have, if you look at grade 4, which is the highest, breast is deformed. When you look at it from a distance, it is deformed. The chest is deformed. It is painful, and the implant is palpable and visible. Grade 3 is the same as grade 4 minus the pain. And if you will look at grade 1, the breast is soft, implant is not palpable or visible. You could certainly have a grade 1 contracture and still have ruptured implant and not know it. And this is why, if you look at the FDA and the manufacturers themselves tell you, if you have silicone implants, you need to get a MRI at year 3 of the augmentation, and then every 2 years they're onward. Now, let me go ahead, and this is what I'm going to state. If you look at this, I want each and every one of you see this. This is the advertisement out of the journal that we read as plastic surgeons. I want you to look at this. It says natural feel, shape retention, and then the advertisement itself. Now, I do not know if you can see, I've got the same over here. I put down danger on the implant. And if you will, I want you to go ahead and see, because of, I guess, this is the paper that I'm going to read. I want each and every one of you, if I can assign this as kind of a homework, I'm going to read what the manufacturer's mentor itself has stated. It states, and this is kind of answers the very first question that I saw. Breast implants and breast reconstruction, breast implant surgery, and I quote, breast implant surgery should not be performed in women, number 1, with active infection anywhere in the body. Number 2, with existing cancer or pre-cancer of their breast who have not received adequate treatment for those conditions, close quote. Women who are currently pregnant or nursing. So that is this is the manufacturer, this is mentor itself telling you. And again, if I may, I want you to please read this line by line. Then it mentions over here, safety and effectiveness have not been established in patients with autoimmune diseases, for example, lupus and scleroderma, comma, a weakened immune system, comma, conditions that interfere with wound healing and blood clotting, comma, or reduced blood supply to the breast tissue, period. Quote, and I'm still quoting, patients with a diagnosis of depression. So look at that gentleman and the nice lady who asked that question. Quote, patients with a diagnosis of depression, comma, or other mental health disorders should wait until resolution or stabilization of these conditions prior to undergoing breast implantation surgery, period. There are risks associated with breast implant surgery. You should be aware that breast implants are not lifetime devices, and breast implantation may not be a one-time surgery. You may need additional unplanned surgeries on your breast because of complications or unacceptable cosmetic outcomes. And I'm still quoting, many of these changes to your breast following implantation are irreversible. Bracket, cannot be undone, close brackets. And breast implants may affect your ability to breastfeed, comma, either by reducing or eliminating milk production, period. Breast implants are not lifetime devices. Again, they mention this again in another, like in another sentence within the same paragraph. And breast implantation may not be a one-time surgery, period. The most common complications for breast augmentation with memory gel implants include any reoperation, capsular contracture, nipple sensation changes, and implant removal with or without replacement.
It's
And
so
then they mention,
scary.
yeah, and then they mention, like, remember, this is the mentor advertisement, the fine print. And remember, I want you to read not only this, what you see highlighted, but the rest. Then I'm quoting again, the health consequences of a ruptured silicone breast implant have not been fully established, period. MRI screenings are recommended 3 years after initial implant surgery and then every 2 years after to detect silent rupture, period. Breast implants are associated with the risk of breast implant associated anaplastic large cell lymphoma. So this is the mentor ad itself, all right? Now what I'm gonna do here is, for completeness sake, I'm gonna go ahead and I'm gonna show you, this is the other journal, and I do not know if you can see this. This is the plastic surgery journal that I have. For some reason, we cannot
We can't
see it.
see it. No,
Yeah,
because of your
but
background.
I will go ahead and have this up as well. So this is the cover of the plastic surgery journal. And I'm going to read again. I'm going to quote. It says, "Natural, exquisite from every angle." Now I'm going to flip this open and I'm going to go ahead and look at the other side over here, the back. And I'm going to read verbatim, quote, "Important safety information, contraindications. Breast implant surgery should not be performed in women with active infection anywhere in the body, women with existing cancer or pre-cancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing." Now, this is the fine print. I'm reading this, as you will see. Now, the next precautions, safety and effectiveness have not been established in patients with following. Number one, autoimmune diseases, lupus and scleroderma. A compromised immune system, currently receiving immunosuppressive therapy, planned chemotherapy following breast implant placement, planned radiation therapy to the breast following breast implant placement, conditions or medications that interfere with wound healing and blood clotting, reduced blood supply to the breast tissue, clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder or eating disorders. Please discuss any history of mental health disorders prior to surgery. Patients with a diagnosis of depression or other mental health disorders should wait until resolution or stabilization of these conditions prior to undergoing breast implant surgery. Adverse events, I'm still quoting word for word, line by line, letter by letter. Key adverse events are reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture Baker grade 3-4. Other potential adverse events that may occur with breast implant surgery include colon, asymmetry, breast pain, breast skin sensation changes, capsular calcification, delayed wound healing, hematoma, hypertrophic scarring, implant extrusion, implant malposition, implant palpability, visibility, infection, nipple complications, redness, seroma, swelling, tissue skin necrosis, wrinkling, rippling. For more information, see the full directions for use at www.allergan.com/products. Now, I'm going
They
to
know about
end quotes
this.
here. Now, I'm going to say this to you. If I have joined this as a 22-year-old college student, for example, who's interested in getting implants, and I just heard whatever the FDA has said, if I heard just what the mentor advertisement at the journal, that is the most common #1 journal read by plastic surgeons, the end, the back page, and the front page, I will tell you, no person with informed decision, informed consent would willfully, wholeheartedly, happily get implants. And to answer your question, if I had implants, I would have gotten them out yesterday. And I will tell you, I, as a board certified plastic surgeon, what used to be the #1 most common plastic surgery procedure, I chose deliberately, purposefully not to, because of what I see. And I see the third, so don't listen to me, listen to what the FDA is saying. And this is the take-home message.
Yeah,
Don't listen to me.
unfortunately, the sad thing is that many women did choose to have breast implants, and that's why you are here to help them to see how they can feel better.
Sure, absolutely. And this is
they
where,
and everyone has a reason for getting them. So
no,
we
and
have
I will say this to you. This is where I say to you, number one, don't listen to me. What I have just done is I've shown you what the FDA has mentioned, what the mentor the manufacturers themselves have mentioned, what Allergan has mentioned, and last but not least, and probably the most important, listen to the many patients, the many celebrities, Danica Patrick, for example, amongst the many other celebrities, normal human beings who are continuously on a daily basis hurting. They're not even aware that it could be the breast implant illness. There are ladies that I talked to that state that they just found out about breast implant illness 6 days ago. And now they're on this mission to learn and hear. And sometimes they're not able to get the answers. Now, if you just listen to the FDA and all the manufacturers and the patients, there is conclusive evidence that the implants should be banned tomorrow, like they were in 1992. We have the same set of problems with silicone implants, same set of problems with saline implants that occurred in the 92 when the ban occurred. And history is repeating itself. And now you have the many ladies on the social media platforms talking to one another and finding out, overriding their plastic surgeons, their rheumatologists, their primary care doctors, and making that executive decision on their own that they're going to step up and they're going to get an explantation despite what the major medical centers are not saying. And we are seeing the evidence in the masses, right? We're seeing these publications where when the explantation was done right, the patients have gotten better, they're gotten healthier, and they're back to their freedom from the silicone toxicity.
Absolutely. And this is really important information. We have a lot of questions to get to too. So we're going to move to Lucy. She's been waiting for a while for her question. How long after removal do you see those top symptoms resolve or improve, like fatigue and rheumatological issues?
So I want you to hear the many patient testimonials. You will see that on the many Facebook group pages. You will see some patients right within the recovery room, their eyesight is improved. They can see the edges of the box much nicer, the clock. The lady was telling me, a nurse heading back to Columbus, she said, I could see the signs on my 3-hour drive back home much clearer, better. I had high definition lenses, if you will, the very next day. Some patients 3 months later, I felt like it was a waste. Now that's not the majority, that's still 10%. Now I tell them it took you some time to get there. One thing is for sure, number one, you don't have any capsule, you don't have any inflamed tissue, you don't have malignancy, you don't have an implant. It could be an underlying rheumatological problem. It could be the bad diabetes, the lupus, it could be other things. Now, vast majority of the patients, well over, I would say 90%, have reported direct mechanical improvement in their breathing because they don't have like 600 cc implants on their chest. To other patients, 6 months later saying, oh, I can eat pizza now and ice cream. Before I couldn't even eat those because now my food, basically allergy to these different foods before I could eat. After implantation, I could not. Now after explant, 6 months later, I can. So you see, and it takes up to 1 year. And I want to mention there is no detox protocol. There is no special vitamin C. There is no infrared sauna. You know, we should be eating healthy organic food, fruits, vegetables to begin with. Anything processed meat is absolutely out. Anything sugary, high fructose sugar, out. And you will see that the patients are bouncing back and certainly improving their quality of life.
Yeah, absolutely. Kind of similar on this, but Kimberly is asking, I recently had an MRI. My left side implant has flipped, but the MRI said I was clear. She wants to know, how is this possible?
So it does happen, believe it or not. The implant does flip. Remember, the capsule forms. Sometimes the capsule forms are on any foreign body. And so once the capsule forms and basically hardens a little bit, so it's not uncommon that with the fluid around, the small amount of fluid, it will tend to basically flip around. And, you know, there are patients that clearly state, and this is relatively common if you talk to the ladies, that state, oh, this was like this in the morning, now it's flipped down. If I move my arm around, the muscle in itself causes the contraction and then will squeeze around the implant such that it will rotate.
So next question is one question I have about post-op recovery time for an individual like myself traveling to have surgeries. So they want to know how many days should they plan on staying before heading back home.
Good question. It's a very nice question. So let me, so if you have a saline implant that is intact and you are healthy, I will say to you, and remember, a lot of my patients come to me from out of state, and it is very safe, very effective, very practical to manage my patients once they have headed back. So this is a very classic scenario. So I would recommend that she come on a Tuesday. Wednesday, the surgery happens. She recovers Wednesday, Thursday, Friday. I see her in clinic, and I'll tell you well over 99.9% of our patients are heading back. Remember, we'll find out a whole lot more about how the surgery went on the day off. And remember, the saline implants are relatively well tolerated because the silicone, sometimes, especially with the texture, they can be ruptured, more inflammation and other issues. Now, other patients, for example, with ruptured silicone. Now, remember, someone who has an 800cc implant. Now, still those patients, I would see them on a Monday in clinic. Then this is part of the informed consent. So they have seen me, I have seen them, they've seen the facility. We go over the discharge instructions. Remember, I have done a virtual or a phone consultation initially. When I do the surgery on a Tuesday, they recover all of Tuesday, Wednesday, Thursday. I see them Friday. And 99% of my patients are heading back to their home state because they meet criteria and they feel comfortable. And overall, there is only one patient that ended up staying extra, and she was the lady from California with 800cc implants, mid-50s, on prednisone, and they were videotaping her. The Los Angeles group was. So I wanted to make sure absolutely that she was going to do well. And so for that reason, I had her I did her on a Tuesday, and she stayed till Monday. And I tell my patients get travel insurance, and I can then very safely, effectively manage my patients post-op from the comfort of their home once they have headed back to their home states.
So for somebody who may have had the explant done already, this question is coming from Lori. She wants to know if you can tell by looking at the photos of her explant / total capsulectomy if the surgeon got all of the capsules. Her surgery was only her surgery was only 2.5 hours. It was a silent, severe rupture.
Right. Now I will tell you, I've done a lady NBA player's wife in 2 hours and 15 minutes. She was above the muscle, hard grade 4 capsular contracture. Her video is up on YouTube, and I was able to do it. And this is one of the shorter versions. Now it's very doable. Now I will tell you, there are 5 criteria that I have that, at least in my mind, as a board certified plastic surgeon who explants, that your surgeon or your surgery was good and valid. Number 1, the length of the incision. If the incision is this small and the implant was 400 cc's, I can guarantee you the end block or total capsule was not removed. Number 2, if the surgery was not around 4 hours, now 2 hours and a half is, I use the word on a very, very short side, doable, but we will look at, now remember, every surgery in the United States that is done at a reputable board certified facility, patient comes into the OR, time. Patient's incision is made, time of incision. Patient's last dressing is applied, time. Patient left the operating room, time. So you can go and look. Sometimes they could be in, maybe getting an IV. The IV fell out, or they had to put, God knows, the intubate the patient. Sometimes that can take 10 minutes, just to make sure, prepping, draping. So maybe the surgery itself was an hour and a half. So the time itself is a very good indicator. Now remember, each one of them is kind of additive, right? So the length of the incision has to be the size. The diameter of the implant dictates the length of the incision. Number 2, the timing of the surgery, i.e., how many hours was the surgery? So around 4 hours. Now, the more less you go, like hour and a half, that's impossible. But that's the other criteria that you look at. Number 3, you want to get high definition pictures of not only the implant plus capsule together, but the chest wall itself, showing that the whole capsule was removed, because that is the ultimate of proofs, right? You have flash, high definition camera that goes right into, and the surgeon makes an effort not only to take a picture, but I take videos as well. So my nurse, Caitlin, she comes in all the way in and shows, look, the whole capsule is removed. Guys, even when patients, they don't want media, I still take it for the patient and I, so that's my objective evidence. Number 3, you want to return the implants to the patient. How many patients have gone to the other surgeons there? They want to rupture the saline implant, for example, right? So we want to make sure that the implants are returned, and so the patient can check and say, okay, these were intact implants. They were not ruptured or they were not damaged in the process of removal. 5, and probably the most important, your surgeon must have that social media presence, the other previous patients who are constantly talking about validating, confirming, authenticating, reaffirming to another, including the prospective patients who then have that confirmation, oh, this guy is solid, this guy is genuine, this guy knows what he's doing, I didn't have to get it out of him, he volunteered. You should actually show up to your surgeon and say, I don't think you should remove your capsule. And if he says, absolutely not, I'm not going to do your surgery because I have to remove the capsule, that's the answer you want to hear. You don't want to hear, well, I will try and I will give it a shot depending on how thick it is. I will see. That is not the answer. So you want to have that. And your surgeon should. There was a patient who went to a surgeon and the surgeon refused to write on the piece of paper on the consult sheet that the patient has breast implant illness. The first thing that I write on my consultation chief complaint, breast implant illness, desire for removal of bilateral breast implants, essential surgery, non-cosmetic in nature. So I spell this out. The patient is coming to me for what is the most non-cosmetic surgery she's going to have so that she can get her health and life back. Your surgeon must be very proactive, seeing and talking and writing and giving this awareness. I will tell you, your surgeon should and must not be augmenting. How can you augment and at the same time explant? And I'll tell you, any surgeon who is augmenting with pure professionalism cannot be explanting right. And I'll tell you this, and I'll say this again, you cannot accept breast implant illness and at the same time put in implants and kind of have it both ways. You either do or do not. And that's why I tell you should only go to a surgeon who is only explanting and is not augmenting. In 2023, after what I read to you, no reasonable professional surgeon should be putting in implants because you don't want to hurt the patients. Look, I just read to you 6 to 10 years, they start becoming reactive, right? Look, I have another report. There are studies that are done that look, Mentor, and I'm looking at this again, I'll put this up. Mentor is looking at if they're ruptured or not till the 6-year mark. Till 6 years, everything is kind of like the honeymoon period. The problem starts at the 7, 8, 9, 10, and they're onward. Can you show me a study? What is the status of the implants at year 15, at year 20, right? There's going to be no study because you know what? No one wants to scare off the patients. So going back to your question, your surgeon must have this full determined voice that breast implant illness exists and implants need to be taken off the market. And that's the genuineness that you're going to have. One patient from South Dakota, she's a mom of 5 kids. She came to me and believe it or not, from the time it took for me 3 minutes, she and her husband were on the phone and she's like, I'm coming to you. I said, you know what, talk to me more because you just started. You have not asked me anything. She said to me, well, you talk about breast implant illness from the operating room, from this awareness and the many, many, many Facebook Lives that I've done. Remember, every word that I say can be used against me, right? So I have to be very careful. But I believe in this from my heart. Trust me, I would love tomorrow to do 6 augmentations between the 2 operating rooms and be done by 4 o'clock and not have to worry about doing this awareness, meaning this is what's happening, right?
Yeah.
And I would make
I know
3
that
times,
everyone
4 times
here,
as much. I would make 3, and plus, more importantly, my neck would be better too. My neck and back and shoulder. Sometimes when I'm dissecting, believe it or not, ask my assistant, I get spasms in my finger because that's how long I'm dissecting, and I sometimes forget I'm holding it in that very meticulous, detailed, fine, such that every stroke of the bovie needs to be done perfectly. Because if I go in, I'm going to cut the capsule, and I don't want that. I want that end block. So your surgeon must only be explanting. So going back to this lady, she said, you're talking about breast implant illness like you believe from your heart. And number 2, you're not augmenting. And as a board certified plastic surgeon, if you're not augmenting, it's like you're not bending down and picking up a roll of money that has your name on it, that's exactly what it is. And this is the professionalism that your surgeon must have, where he should have no other vested interest other than your quality of life, your pre-op, post-op care, and intra-op care, such that it could not be done any better. And this is what you're looking in your surgeon. You should not be saying, well, I'm going to give it a shot, or I'm going to go through my insurance. Because I'll tell you, no insurance recognizes, the insurance is a big scam in the United States. Number one reason for health, bankruptcy, in the United States. The hospitals are money-making institutions. They deny cases without even opening the chart. Just ask any nurse, ask any doctor, any individual who works at the hospital, how bad, and I'm not making this up, I'm not exaggerating, I'm telling you as is. No insurance recognizes removal of the whole capsule. Look, if you go to another surgeon and say remove the capsule, they're going to be like, what are you thinking? One patient stated, I read today, I believe, the surgeon told the patient, you're reading too much on the internet. The bottom line is your surgeon must be from his or her heart committed, devoted believer in what is breast implant analysis. Then only you're going to have that peace of mind, that confidence, that reassurance post-op. When you put your head on the pillow, post-op, you have that confidence that your surgeon did absolutely the right surgery. And post-op, let's say if you are one of those 10-15% of the patients who have not improved, you're not second-guessing your surgeon's integrity.
And we can definitely tell that you are passionate about this, and I am so glad that you are. We have just a few more questions. I want to get to Darcy. She's had her hand up. If you want to unmute yourself and ask your question, I'd love to hear from you. Hopefully she didn't step away. Oh, there she goes. I am not hearing you if you have a microphone on. But while she's figuring that, let's go to Donna. She wanted to know, how long after consult is surgery booked up?
So I'm not the type, so this is again a very, very, very important question. I'm not the type, so I do the screenings. I'm very much hands-on. I am talking to you in the pre-op room. Yes, my nurse is involved, but I'm doing all the questioning, the initial screening. I'm basically going over the entire history and physical, the medical clearance that I require of everyone. The limiting factor is usually and always has been me. I'm not the type, till a year, like maybe 6-8 months ago, I didn't even have a website. I had literally spent, I would say maybe $0 on marketing. And now I'm starting to, with your group, for example, trying to raise awareness as best as I can, trying to educate and trying to bring awareness to the many who have not even heard of breast implant analysis. Now, my today's purpose is not for my listeners or the patients or the significant others to make a decision. Right now, we're just educating. We're teaching and telling you what is in reality, the reality of what is breast implant illness, right? And look, we have overwhelming a mountain of evidence. Going back to the point here, the goal here is for you to make a sound decision and then be able to reach that conclusion that the implants need to be only removed. Now, when someone calls the office, I screen, I request for information, maybe an MRI, maybe a lady has never had a mammogram. Look, yesterday, and I was telling the group, one lady, believe it or not, God bless her soul, from Florida, she was diagnosed with breast cancer. I don't want to be finding out on the operating room table that she has breast cancer and having to deal with it, right? Or having the cancer taken from one side to the other. So I screen my patients, making sure that they have had an adequate workup. I told her, please do not come to me till you get the full staging. And she's off the list. She was supposed to be operated on next Tuesday in 6 days. A nice lady from Florida in her mid-40s. Now, going back to the point, I have had, believe it or not, requests by many other Facebook owners that say that we will advertise you on our Facebook and we'll send you patients. This is illegal. This is the Stark law violation, where you're incentivizing paying someone to advertise on their Facebook. so that you will get kickbacks. Absolutely forbidden. And I will tell you, not the standard of care, and the professionalism is down to zero. For me, when you call the office, I have a very reasonable wait. I want to see my patients. I want to have talked to my patients within the last 3 months, maybe 5 months, 6 months, but not like a year out. I can easily get to these Facebook or Instagram and whatnot else and get my word out and fill. If I was interested, and this is what I've heard, and again, to answer the question, you will get your answer and you will get your surgery date in a very reasonable fashion, not like a year out, not 9 months out. And I want to have known you. I want to have heard about you, because the 9 months, a year out will be a different patient.
Absolutely.
And you will go through the right selective process. If someone, for example, has a TSH that's 53, that's an abnormal lab, I want to have her get things normalized before I would schedule her even for the surgery, because she's not a candidate for surgery at all, because we don't want any surprises on the operating room table. Remember, there is pre-op, intra-op, and post-operative care. The hardest part for me is the pre-op care, where I'm screening patients and I'm making sure they're optimal and ready for surgery. Today is Wednesday. 2 days ago, I operated on a patient. She had heart defects, surgery as a child, and a stroke at age 4. Another lady I operated on 9 days ago at the hospital, she had a clot in her neck. I wanted to make sure, and she herself was the best patient ever. She talked to the right anesthesia team members, and she was very well prepared. The point I'm trying to make here is the pre-op care is the hardest. The intra-op care is certainly the challenging part for me. The post-op care certainly can be involved depending on the patients, for example, and their recovery, but usually is an excellent post-operative recovery for the vast majority of the patients.
We have just 2 more questions left. So the first one I have is, I know there are different options for payment. This is from Kimberly. What about the low-income community that would like to have their implants removed? What is the minimum cost for removal? I assume your team works with them.
Yeah. So this is a very good question. Now, I will tell you, someone from California, the dollar means different to them than someone, for example, from the Southeast, right? Or someone from, the Midwest. It's very standardized. Remember, just to open up the operating room, it's almost $1,000. Remember, I have quality staff, I have certified facility, and this is the time where just to get braces, for example, costs $5,500, right? My costs are very reasonable between the anesthesia facility fee and my professional fee. And this is the 4 hours, 5 hours. Now, as you will see, if someone has a ruptured implant, there is a certain cost added. If someone has an 800cc implant and above a certain number, for example, 500 cc's, I charge extra. If someone has history of silicone rupture, so this one patient, for example, that came past Friday, she thought she had above 500, she paid. Now, she was 420 cc's to be exact. We refunded her the amount. And again, this is very much transparency, so that every patient, depending on their level, for example, if they have cadaveric skin, alloderm, that needs to be removed, I will go ahead and charge extra, because that requires extra amount. And you will see it's a very standardized fixed number, and there's no quote surprise billing. I used to remove the skin, and now I have made it part of the whole, because some patients were saying, well, I was not made aware that this was what you're going to remove. And I tell them, removing the extra skin and contouring takes extra time, and this is where I pass that minimal amount to the patient.
So it sounds like it's very personalized.
Yes, and very defined and very fixed. And you will see the numbers that we will send you when you first talk to us on, I believe, your first initial phone call.
Absolutely. Well, I thought we only had one more question left, but I see a couple of hands raised. So I want everyone to have a chance to ask their question. Darcy, we'll try again. Can we unmute you and hear you this time? Yay, there you are.
Hi. Okay, I'm sorry. I'm really bad with technology.
All good.
Okay,
No,
so
you're doing
I just
great.
have a question really quick. I know that I talked to Dr. Khan several times, but I have peripheral T-cell lymphoma, and I do believe 100%. Well, so does my oncologist believes that it's from my implants. And I did hear a little bit of what he said on that part, but after I did my first chemo, really bad. It came back tenfold, and my lymph nodes are like really swollen. I guess my does a person have a chance to be able to fight cancer, I guess, with the with the chemo, and then I still have my port in. So can you still take the explant out plus the capsule?
So yeah, no, and I remember talking to you, and I believe I just talked to you a few days ago, and my heart goes out to you. You know, you have lymphoma, and God bless your soul. You know, what I want to say to you, and I want my listeners to hear, you know, you're undergoing chemo. Just the fact that you're undergoing chemo puts you at an immunocompromised state. Just the fact that you have lymphoma, right? I don't want to be going in and then there is wound breakdown, problems, complications, right? And any doctor will tell you you are not safe candidate for surgery because of the many potential problems. Remember, you're like kind of the bubble boy, if you will, right? Because your chemo and along with the risks, side effects of the lymphoma itself. You want to, just like this lady from yesterday from Florida, you want to get that treatment, and hopefully you will fight this. You know, you're very determined. You will have the excellent group of oncologists. You fight this, you normalize, you get done with the chemo. And once you have that clearance from your doctor, I will be more than happy to operate on you. And remember, some chemo affects the heart. You can have congestive heart failure as a result. The chemo can be very strong and very bad. Sometimes they've had to stop chemo. Now, hopefully you're able to do it and you're able to fight it. Depending on the lymphoma that you have, some of the prognosis can be excellent. Now, I'm not an expert in medical oncology by no means. I could, you know, that is a field in itself. But once you get that clearance, I will tell you, just like these two ladies I operated on the last 2 consecutive Mondays who were very ill, when the anesthesiologist is telling you you have sick patients that you brought, I will tell you, you bet. I took care of another patient, 42, with metastases of breast cancer to the neck. And she had a pericardial window because she had a cardiac effusion. And I still operated on her. You know, another lady with significant pulmonary hypertension, I will operate on you. And I will make sure that you meet criteria such that when you get your surgery done, you will have the best optimal post-operative recovery. And this is what I was saying earlier, the pre-op phase right now does not allow me to operate on you safely. I don't want you to get hurt. And I will tell you, I love to operate and I'd love to operate on you, but now is not the right time.
Dorothy, I don't know if you can see the chat here, but there are many folks who are sending prayers and warm thoughts your way. And you know,
I'm a big believer in faith and God, and I will tell you, it's mentally, you remain strong. You're getting tested, and I will tell you, you will bounce out of this, like the many ladies do, like that lady from Florida. You know, she obviously was very much distraught. You know, mid 40s. And she's diagnosed, and you look at yourself, you're young, and you're going through this, you will fight this, and it will not be long before we meet, and I will operate on you in a very controlled, optimized way when I have the medical clearance from your doctors.
We have one more raised hand. Julie, if you want to unmute yourself, go ahead and ask your question.
Yes, hello, thank you. I would like to know, because I have my implant already out, but in the time I went to see the doctors, they did an ultrasound and they found pieces of silicone. So where it was my implant, they took out everything, but the other ultrasound saw some pieces around my liver or my esophagus and other place. And I would like to know what other tests I can make to see if I have in the brain or another place in my body, to see where are the other pieces of silicone, and if we can take it out, yes or no, and what the damage can they cause.
Right. Now, again, I'm very sorry to hear your story. and what you're going through. You had a ruptured silicone implant, is that correct?
Yes, I had an implant inside my body in 1988. I was 17 years old. And in the same day they put it in, it explodes. They leave me like this for 6 months. And then they took it out in the wrong way because they left most of everything inside. They just took out what they could take it out. And then in 9 months later, in 1989, they put another one in. And after I kept this one for 30 years. So I got my implant out with the capsule, with the NAND block in 2019. But the ultrasound I made in my province, I'm from Quebec, Canada. That's why I speak maybe with accent because I'm French. They showed nothing is wrong. And about 5 days later, I went in Ohio and we did another ultrasound and we found out all the pieces around my capsule. So Dr. Frank took everything out. So I know that in my chest, what needs to be out was out because I have only one implant because it was only to correct an asymmetry. So
Right.
This is
Yeah.
This is
because
out.
that's why you got it at age 17. Now, Dr. Feng did your surgery?
Yes.
So I salute her. She's the queen of explant, and she has done a lot. And I congratulate you for doing your homework and going to one of the finest surgeons on earth, who's truly an advocate. And I'm very happy to hear that. So that puts to rest, those criteria that you got the best surgery. Now, remember, the silica did go into the lymph nodes and then into the periphery. We know this from Dr. Henry Dykman's studies and other studies that have been done, which showed that there were silica deposits within the lung tissue, within the spleen, within the connective tissue. Now, I myself, as a plastic surgeon, do not know of any antidotes or any products, chemicals that you can take, especially as a biochemist. Remember, this is part of my training as an undergrad, that will leach or pull out the silicone from within the many different organ systems of your body. Now, I will tell you, you got the best surgeon removing the whole capsule, plus I'm sure all the inflamed tissue and whatever, all inflamed tissue that was there in the periphery. Now, this silica that has migrated and deposited in the different tissues, and we know from Dr. Henry Dykman's, for example, he did a biopsy of the different organs of this patient who died from who died for other causes, but she had known silicone rupture. They found there is no way of pulling out the silicone. Now, over time, the body itself can cleanse it with macrophages and other, histiocytes and giant cells, for example, that cleanse the body of toxins, right? And so hopefully with time that your symptoms improve. Now, let me ask you a question. How have you felt post-op having had the explantation done, and what would be the genuine complete explantation?
Well, first I was bedridden and I was invalid 2 years before getting my implant out. I was sick. Like I thought I would die. So I did my testimony. I had pain from the head to my toe to all my bone. I had pain with the over 60 symptoms, like maybe 17 more symptoms. I was really dead sick. And when I got up from the surgery, I swear I had no pain in any part of my body. All disappeared like this. To me, it was a miracle. I was sick for so many years, and it was really a miracle. And then to me, I think it's 90% of my symptoms are gone, because what is left, it's the sleeping problem, that I don't go in a deep sleep, and my intestines are really with a problem. But besides those two things, or maybe a little bit of my memory and attention problem.
Right.
Besides this, everything is gone completely.
This is the faith, the confidence that I have in Dr. Feng. Like I said, truly a gifted surgeon, a surgeon who has done a lot, and I'll probably say that the best explant surgeon with the you know, she is very senior. You know, I've met her when I was in training and when I was in Cleveland, and she's truly an outstanding person in every regard when it comes to explantation and overall professionalism and the expertise and what she has done in the world of explantation. Now, this is, I knew what your answer was going to be. Now, I tend to look at it like this, if I may, and I say this with confidence. If you have a swimming pool and you have a red dye and a red dye ball, if you will, and you throw it in the pool, all of a sudden you see the red dye starting to disintegrate and give off its red color and slowly spreading over. You can look at it analogous to silicone, right? Now, the goal here is to jump in, remove that silicone ball and throw it out of the swimming pool. You'll still find that there is still red dye floating around. Now, at least damage control has been done. The source of the evil has been taken care of. And whatever red is floating around now, hopefully with oxidization, the body itself, time, it gets diffused and less of an issue. So my prediction, and again, this is again anecdotal, there's no scientific evidence and more research needs to be done. As the years progress, your body in itself and the way God made you will hopefully get better. That 90% will become 93, 94. And as the years add on, hopefully you will be able to get in that REM mode of sleep and get that deep sleep that you need. And you will be able to better improve, and this will become a distant history. And so this is what I anticipate. Now, as far as someone taking charcoal, that's true for someone who, for example, wanted to commit suicide and took 60 aspirins, and you give in the emergency room the charcoal so that it will bind to the medications that the patient overtook in order to commit suicide, and it will come out from the bottom. You do not put your feet in infrared sauna and it's going to break down the silicone, for example. You're not going to take the celery, or now over time I should eat healthy. Everyone should eat organic food, non-processed meat, like I was talking about earlier, and hopefully diet, exercise, positive thinking. And this is what it takes to detox. The best detox is what Dr. Feng already did, what an excellent explant surgeon did to you.
Thank you.
There is nothing else that I can think of that you can do. Now, there are suggestions of another chemical that you can take, but there is no scientific evidence to validate that.
Okay.
So hopefully I've
There's
answered your question.
no test that can show I have something somewhere. Because my question is, what if I have other pieces in different places in my body?
It's going to be small microscopic particles. Now, I know this why, because I asked Dr. Atul Mehta, A-T-U-L, last name M-E-H-T-A. So this is a case report out of the Cleveland Clinic, the #1 heart and lung center of the world, where he himself presented a case of a patient, and he presented a patient with saline implants that had ground glass opacities within the lung and silicon deposits within the lung because he biopsied the lung. And this was an active live patient. And a year later, her breathing improved, her symptoms improved, and he stated clearly that the silica leached out from the intact saline implants and migrated in the blood to the different organ systems. So that silica that moved out into the blood is small microscopic. You cannot have big particles. Otherwise, you would end up getting strokes, you would end up getting pulmonary emboli, things like that. You follow what I'm saying? It's not going to be fragments of, it's going to be small microscopic. Now, why do I know this? I took one of the saline implants from my patient intact. And it was the saline, right, that you give to a newborn and to any patient that goes to the emergency room, for example. So the saline implant I took, and I put it on a FedEx, and I sent it to Dr. Henry Dijkman in the Netherlands. I told him, and remember, he's a researcher, he talks about it. I told him, take the saline from inside that saline implant, the shell of which is silicone, and take that saline and centrifuge it. And he did centrifuge for 1 hour at 11,000 rotations per minute. And then he collected what was a small pellet, and then he looked at it under electron microscopy. So he's looking at hard evidence now, right? And he showed that those spheres at the bottom were indeed silica particles. Now, this is proven. I have done a Facebook Live with him on this, and I want you to see it. So those small particles certainly are what, on a regular basis with patients with saline implants, this is, again, 1 + 1 is 2. These are the silicon particles that now are leaching and going into the body and causing these silicon toxicity effects of what is breast implant illness. And lo and behold, just like that patient of Dr. Atul Mehta, MD, transplant pulmonologist, king of transplant pulmonology at the world-renowned Cleveland Clinic in Cleveland, wrote a paper on this, who I interviewed, and he states that this is the small silica particles. And then looking at my presentation, you have these small silica. So you don't have fragments of silica elsewhere. You have what are small particulate, small pellets that are there that are causing or continuing to linger on. But Dr. Feng, as you mentioned, took care of the rest of this grossly when she removed not only the implant capsule, but also that residual silicone that was present because of your age 17 implant that ruptured. And majority of the times, if it ruptures that early on, your surgeon made a technical problem mistake into potentially cutting or basically harming the implant back then, because implants don't rupture that early on. Yes, that was much older technology, but it is well proven in the world of plastic surgery. If an implant ruptures within the first few months, it was by default a technical problem of the surgeon potentially hitting it with the needle or harming the implant as a direct result of putting it in.
Well, Dr. Khan, we're running short on time, and we could talk about this all night. We have a few questions that we did not get to.
I wanted to say thank you very much. And you're right, that the doctor told me that she broke the implant while she was making the scar. She broke it, and she said that to me. That's why it explodes.
And again, God bless your surgeon. She was honest, professional, and transparent. And we are human. We make mistakes, right? Remember, the goal here is do no harm. Help everyone. From the bottom of my heart, I can see what you went through from age 17, all those 30 years, and remember, if you look at, I'm going to hold this, the journal again. The journal says silicone implants should not be put in anyone less than 22 years of age. Now, for cosmetic reasons, but in your case, it was reconstruction because you had hypomastia, meaning less of a developed breast tissue, which was a growth problem for you. Now, thank you very much for acknowledging that. And again, I took care of a nice lady from Montreal, Quebec, 4 weeks ago. So I always welcome my Canadian patients.
Okay. Thank you very much.
So,
you're welcome.
Dr. Khan, if there are folks who haven't had their question answered, there were a few that we didn't get to. How can they get a hold of you? Can you tell us about the
yes,
Facebook?
So what I want you to do is, first of all, go into my YouTube, my webpage, executiveplasticsurgeon.com. Go to my YouTubes, listen to this very similar Zoom/Facebook Lives. Remember, you have to do the homework. You're like kind of on a listening tour, if you will, right? You're not making any decisions. I want each and every one of you to reach 2 other plastic surgeons at least before you make a decision. Remember, every single time you talk to someone, you are going to make that better informed decision about what is the goal of the surgery. Remember, we talked about this a lot tonight. I want you to go ahead and talk to the previous patients. I want you to go ahead and listen to the many questions. Remember, we have had a lot of questions, but no question on drains, no questions on lift. We have had the flat closure, patients with breast cancer, for example. So you have a lot of information that you have yet to decipher through, digest, process, ask questions. My suggestion would be talk to me as a consult. Now, remember, write the questions down. On our first phone call that you make to us, we give you what to ask your plastic surgeon as far as questions go. You should have that firm faith, confidence in your plastic surgeon that you're going to get the best surgery. Look, the moment you mentioned that honorable doctor, Dr. Fang, I was smiling, I was at ease, and I knew you were in good hands. It was not like that other lady who called earlier where she had the capsule cauterized. Now, I'll tell you, the surgeons out of goodwill and good faith will say, you know what, if you want me to do it, I'll do it. But remember, when the going gets tough and that faith gets tested, the question becomes, is the whole capsule going to go plus all inflamed tissue, and that it's going to be checked or not? And remember, it is a whole series of things. And now remember, I'm going to mention the Khan procedure. I want you to read up on it, where the implants are always returned to the patient. The capsules are always sent to pathology to rule out cancer. Microbiology cultures are always done. Number 3, to make sure that there is no fungal, aerobic, anaerobic. Twilight anesthesia sedation is done, not the general. The implants, as mentioned, are always returned to the patient. There are no drains. I'll tell you, it's been 3 years since I've used drains. And remember, the vast majority, hundreds and hundreds of patients that I've done where the need for the drain was not there. And I want you to see my YouTube videos and Facebook dissections that I've done. You can see live the blood loss in well over 97, 98, 99% of my patients is well under 10 cc's. There is no lift done at the same time. And then number 8, the same surgery that I did to the 25-year-old, I offered to the same lady with a clot in her neck, and another lady that I did with open heart surgery and history of stroke and history of being on a blood thinner. No compromise, where the 100-100-0 rule is done and the pictures are taken, and objective evidence with videos and pictures only to show that the complete capsule was removed. Remember, this is your surgeon who should completely, willfully, from his heart, should love this process of explantation. You cannot force someone to love something. It has to come from within. So your surgeon must love to sincerely do this, because your health is dependent on him, on her. I can only do so many of these operations per year. My goal and objective here, I had a plastic surgeon who joined my private breast implant on a support group so he could hear firsthand from how I do it. It makes me humbled to say, you know what, I did not implant for a reason, and I was doing everything except for basically augmentation. Now I only explant, and I'm humbled to say I could never imagine in my wildest dreams that this is what I would be doing, and I would be talking about it actively. And I'm very honored to state that we are making differences in many people's life, not only the patient, but her significant other, the daughters, the sons, the grandmothers, the neighbors, the work environment. Look, we have, a reporter, here in Michigan, Tracy Gary, for example. Look how much she was full functioning, very, practical person. We have had professors, we have vets, for example, and now they're not able to function, right? Now they're able to go on with their lives and reduce like 30 pounds of weight because their surgeon honored them and removed the whole capsule. And it's all a matter of getting health back, doing no harm, because implants only hurt the body. If I told you, and I use this example, we live in the Motor City, Detroit, we sell cars here. If I told you get a car that's going to break down, that's going to have transmission problems, that's going to have a broken axle, that's going to basically, the airbags are going to give out, the seat belts are not going to work, or the tires are going to give out, you would not even look at the car, right? Look, all those problems that are read out to you by the manufacturers themselves, right? Look at the problems. And essentially the point here is, the take-home message is do no harm, and you want to educate yourself about what you're signing up for. You want to get rid of the badness before the badness gets worse, before it ruptures, before other problems set in. And, I will end with this. Breast implants are bad of all the reasons. Another reason I talked about kind of briefly, 1 out of 8 or 9 women are going to get breast cancer. Now imagine you have large implants, 600 cc's, and now you're not able to do a self-monthly breast exam, which is the #1 way that breast cancer is diagnosed, right? the self-monthly breast exam. Now the lady is afraid to get a mammogram simply because she's afraid that saline implant might rupture, or she might disrupt the capsule, or it's very painful. Now breast cancer is being missed, definitely. I've had many ladies that state, I don't want to get a mammogram for that reason. I tell them at least get an MRI for that reason, because 1 out of 8 or 9 women are going to get breast cancer. There are ladies with contracture infection. You know, you heard about the malpositioning, the nipple sensation lost, the bottoming out, lateralization, the rupture, the silent rupture, lymphoma, cancer, right? All these symptoms of joint pain, breast implant illness. Plus, you know, if you have a 20-year-old lady, let's say 22-year-old lady, right? In this case, the 17-year-old lady, for example, the nice lady from, she should have had an MRI at year 3 and then every 2 there onward. So according to the FDA protocol and the manufacturer, she should have had at least 16 MRIs in her lifetime. Look, the FDA or the insurance companies is not going to pay for even one, because they say you put it in for cosmetic reasons, and only 5% of the patients, by the way, get MRIs regularly to look for what is a silent rupture, and majority of the ruptures are silent, by the way. So majority of the implants that rupture are silent ruptures, where the patient doesn't know, neither does the surgeon know that these were ruptured. So going back to the point, implants are not safe. They don't belong in the body. They don't belong anywhere except for underground. This is sand, silica dioxide. Look at the ingredient list of the implants, right? This is sand. Implants should be banned, both saline, silicone. These are not safe devices. And hopefully I'm able to convince one person to get her implants out or not get an implant, and that is success tonight.
Thank you, Dr. Khan, for being here, and we'll thank everyone who attended tonight. And please, if you get a chance to follow, thank you for putting that up, the Facebook support group that Dr. Khan mentioned, and look at his social media if you'd like to stay in touch. Thank you, everyone. Have a good night.
Thank you very much. Take care. All the very best. Bye-bye.